I work in our main office in Nashville. We have 5 branch offices scattered throughout Metro Davidson County where we provide services for people. But our main campus is the Lentz building. It's a building that's about 16 years old and it had never been updated since it was originally built. So it had fairly outdated audiovisual equipment and public space usage equipment. At a Nashville Strong Babies 20-year anniversary meeting where our mayor, Freddie O'Connell, was presenting an award to Nashville Strong Babies group. And he was at one end of the conference room and I was standing at the other end and we could not hear him. The audiovisual equipment wasn't working. The overhead projector died in the middle of his presentation. And I said, okay, I have PHIG funding. I have A2 foundational capabilities funding. I'm going to update these conference rooms. So we've updated the 3 conference rooms and now successfully use them. The Centennial Conference Room spaces at our main Lentz building are used annually by about 400 different groups for either their quarterly meetings, their monthly meetings, their bi-weekly meetings. Depends on the group, how frequently they meet. And that comprises about a total of 18,000 people that use these 3 different conference rooms or WebEx into meetings now or attend it. I think the audience is probably a lot larger than 18,000 now that we have full WebEx capability and people can broadcast their meetings to members who are not able to attend in person. So it's made the rooms a lot more user-friendly, a lot more usable. We've had our behavioral health summit held there twice now, where we bring in all of the surrounding communities around the Metro Davidson County area that are participating in our behavioral health and violence response units to meet in small groups because we can break the conference room into 3 areas. So we tend to break it into 3 separate groups and have different discussions like domestic violence. We'll have mental health in one and we'll have mental health awareness in the other one. So those rooms can be broken up and used by the same group in different ways. The other advantage for the spaces, quite honestly, is it's had, since the PHIG grant is also inward facing on workforce development, small team events, large team events, individual bureau, division, and program events where they didn't have somewhere before that they could meet and engage, or even if we're in 5 different buildings around the city of Nashville, we could have all the teams connected through WebEx and participating at the same time in an event. With the behavioral health group, for example, we could only reach people who could come to us, and by having it available and having full WebEx capability, we were able to broadcast the Behavioral Wellness Summit to probably an audience of upwards of close to 20,000 people over the 3 days of the Behavioral Health Summit that could log in as they wanted to attend different sessions or see different speakers. Normally that summit has about maybe an attendance of about 2,000 people over the 3 days that come in, and we've had to hold it in different venues, but by having it available online, we were able to also bring in speakers who couldn't travel to Nashville, but who could participate in the WebEx and offer guidance, expertise, and even first case scenarios of what other jurisdictions are doing around behavioral health and wellness. Fairly new to public health, but looking at the 2 years I've been there, I haven't seen any other opportunities or grants like the PHIG grant, which are directly aimed at improving both how we engage our workforce, but also, more importantly, investing in the infrastructure.